Kenya has one of the largest numbers of people living with HIV in sub-Saharan Africa. While Kenya has seen a progressive decline in HIV prevalence among adults, prevalence continues to remain high among key populations, which include female sex workers, FSW, men who have sex with men, MSM, people who inject drugs, PWED, and transgender people. They are a priority population in the HIV response. Kenya conducted several remapping and KP size estimation exercises between 2017 and 2020.
There was KPSE 1, which is Key Population Size Estimates Phase 1, which focused mostly on mapping and enumeration.
In the first stage, with the help of KP implementers, especially peer educators and outreach workers, a line list of all physical sites where KP individuals solicit clients, conduct sex work, cruise, meet other sexual partners, or inject drugs was developed. At the second stage, the peer educators and outreach workers visited each of those sites and validated the existence of the site. If the site was closed or renamed, it was noted. All the sites that were open and active, the peer educators and outreach workers conducted a focus group discussion with KPs in the site and other key informants to understand the operational timings of the site, days with higher clientele or KP visiting the site, and the estimated number of KPs who visit the site on a normal day and on a busy day. During the discussion, the key informants were also asked if transgender people visited the site, and if so, their size was also estimated.
Consultation was done with the other peer educators and the key populations in the implementing partners cohort to understand if there are new hotspots that have emerged or some old hotspots that have been closed.
Kenya also conducted virtual mapping and size estimation for MSM to map and estimate the MSM who seek partners in the virtual spaces and who may not visit the physical sites. However, the country needed KP size estimation for 47 counties, and hence KPSE Phase 2 was conducted in 2019. 5 urban counties and 2 rural counties in Kenya were randomly selected, and multiple methods were used to generate estimates. These methods included unique object distribution, unique event multipliers, and 3-step capture-recapture. For the unique object distribution method, a unique object is distributed to the target population 2 to 4 weeks before unique events are held. This was soon followed by the unique event multipliers, which were publicized planned initiatives designed to bring KP groups together in the selected counties. All the people attending these events were counted and asked a set of questions upon entry about the unique object. Had they received it? If they could describe what the person who gave it to them was wearing, could they show it? Could they identify it from a set of photos? MINI-Respondent-driven sampling, or MINI-RDS, was used in the 3-step capture-recapture method. In this case, coupons are used to recruit the KP of interest. The coupons are distributed to seeds. These are members of the KP community or people who regularly interact with the community. Once the coupons are distributed to the seeds, they hand them out to their peers, who are then directed to a physical location where they can be interviewed.
Before the KPSE came in, we had an idea of key population in the country, but we could not quantify.
Kenya has been able to use our size estimation reports to allocate resources, either from domestic sources or from the funding. That was not the story 10 years ago when we didn't have the size estimate. So it has been a game changer for the country.